You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says, no more dentures. Dr. Anthony Sclar literally wrote the book on dental implants that is used by dentists and universities all over the world. With us, we have an expert on the topic, board-certified oral surgeon, Dr. Anthony Sclar. Dr. Sclar, welcome to the program.
Thank you. Thank you, Randy. Well, I'm really happy to be here.
Thanks.
A lot of people don't know, but there's so many people out there in the country that just are suffering with dentures or they're suffering with failing teeth. And we have new technology that we can take care of that. Just in a single day, we can transform their lives.
Now, at the top of the program, I said no more dentures. You believe that? No more traditional dentures?
Well, the reason I said that is because when people are wearing dentures, they have a progressive loss of function. They can't chew, they have pain, they have their confidence goes down because their dentures are moving, and then we see them and with a pretty short procedure where they feel nothing, they don't feel any pain, all of a sudden they're transformed because now they have a set of teeth that are attached to the implants. They can begin to regain their confidence in conversations, social situations. They also really start enjoying their food. So now they can go out with their friends, they can have a steak, they can have corn on the cob, they can actually bite an apple, and they're not self-conscious. They're not hiding their teeth. Most of the patients that come in my office are hiding their teeth because they're ashamed of the way the teeth look. So the other thing, it's a serious health concern. When you have dentures and you avoid foods with good nutritional value,
and fiber, things like that.
And fiber, your health goes down. And we get a lot of referrals from physicians who say, Tony, you need to do the same day tooth thing on these patients.
Okay.
And we call that the smile lift dental implant procedure because the patient's smiles really come out. And not just the patients, my team, we are so happy to see them.
Okay.
And just a few hours later, they look completely different. Now, the other thing that happens is they come back for a checkup in a couple days. As little as 2 or 3 days, we do a checkup.
These are people that were wearing dentures or had no teeth.
And we
and after the procedure, they come back in a couple of days. I want to make sure I'm following this.
Yeah, and we do a checkup on them, and all of a sudden they're dressed differently. They have makeup. They look at least 10 years younger, and their whole body posture is different. They are confident, and so it really improves their life.
Good.
The other thing that we see is over time, patients lose weight. Unbelievable.
Because they're eating better?
They're eating better. They're eating foods that have high nutritional value. They're avoiding foods that would have them gain weight. And they reap health benefits. So when they come from a physician, the physician tells me 6 months later, wow, sends me the blood studies. Look how much healthier this patient is now. It's amazing. It's just amazing.
Now, are there that many people where you are wearing dentures?
Well, it's amazing, but there are a lot of people in the state of Florida. I practice in Miami, Florida. I would say that you could fill the Miami Dolphins football stadium 5 to 10 times with denture wearers.
Is that right?
5 to 10 times. Up to 1 million people in Florida
right?
are wearing dentures.
If it's so good, though, I guess the whole idea here is dentures aren't attached to anything, right? They should be attached to dental implants. If it's so good, why aren't they all doing it? What's your take on that?
Well, the denture wearers, what happens to them, you have to think about the past when they first had the first tooth removed. And maybe that tooth could have been saved, we don't know. But they had a tooth removed, and then it's a domino effect. They had another tooth removed. Then their teeth start drifting and moving in their mouth. They start having trouble chewing. They have a root canal. They have another extraction. Imagine this. Maybe you can't imagine it because you have a great smile.
Thanks.
These patients have been going to the dentist 50 to 100 times. 50 to 100 times. Think of how much time that took out of their life. And they're afraid. They're afraid because
they don't
when
want to
they've
go
been
to
in
the
the
dentist.
dentist, not all dentists are gentle. All their experiences have not been good. So they are afraid. And the patients that have lost all their teeth, they're almost happy. They're happy. I lost all my teeth, but they don't realize.
Because what, it's over?
Because it's over. Their life has changed, and they don't realize it because they're not going out to dinner with their friends. they're not confident in conversations. They maybe don't go for that job interview because the dentures are going to come out.
Is this
or
what they
move.
tell you on consults?
Yes. Oh, they tell me.
Really?
They tell me all this stuff. Now, there are another group of patients, though. And those are the patients that are only halfway. They haven't gone to a denture. They have teeth. They wear some kind of partial prosthesis. It's not comfortable. It hurts. But they're not going to let it go.
That means they're headed for dentures.
They're headed for dentures.
And they don't. Nobody wants false teeth, obviously.
No.
So how has it changed now? Because you say you do it in one day.
Yes.
You can't do it in one day.
Yeah. Well, this disease process of having sick teeth in their mouth is affecting their entire system, their general health.
But isn't it true that if these people have gum disease, right, a bacterial infection, their gums are so bad they can't get dental implants?
No, that's
Is that
not
true?
true. No, that's not true at all. We can remove the teeth and we can clean the areas. And with a new procedure that we do, even though they've lost a lot of bone, so their jawbone's like a roller coaster, up and down, we can level it and make it smooth and then place these special implants with a minimal amount of bone. Most of my patients that come to me in this situation have been told they don't have enough bone. And it's not true. In my experience, we really have never turned a single patient away because they didn't have enough bone.
So a denture wearer is watching this. Can you be in your 70s and 80s and this still works? And can you be in a denture for 30 years? Because isn't it true that if you've been wearing a denture for 30 years, you don't have enough bone?
Even if they've been wearing a denture for many years, we find when we evaluate them that they have enough bone to do the procedure.
So what's your oldest patient?
101 years old.
Why would a 101-year-old want to do this? Want to get dental implants?
Well, that particular patient that I had that was 101, she was active still, and she was social. So she wants to be out with her friends. They play bridge. She wants to be able to eat.
Okay.
She doesn't want a denture when she goes to drink her martini that it tips down. And that's what she told me. That's what she told me. She said, you know, when I even just have a drink, then my denture falls down and I have to turn around and push it back up and I'm so embarrassed. My girlfriends have teeth. And I said, well, you know what? You're going to have them too.
For people just tuning in, we're talking to oral surgeon, Dr. Anthony Sclar. He says no more dentures. And we're talking about replacing missing teeth with dental implants. Does it cost more to go to a world expert on this topic? And I'm not trying to side with you, by the way. People need to know it's a real interview. But, you know, you're known all over the world and country, right, for dental implants. Does it cost more to go to somebody like you? No,
that's a misconception. I mean, the cost or the fees for these kind of procedures are fairly standardized as long as we're using the best technology, the best parts and pieces, because there are differences. The materials we use, the dental implants that we use, are built to last, and they have the most research of all the dental implant systems. So they've been tested.
How long
can
they last, by the way?
Well, they can last a lifetime. And many of our patients, we see that I've been in practice for a number of years. We've had people pass away, and they passed away with their implants. They were perfectly healthy. But like anything, there is a certain amount of maintenance. So they have to brush their teeth. They have to clean the teeth.
So they're like their own teeth.
Like their own teeth. And
is it a third set of teeth? You told me that. You
Yeah,
call it like it's your third set of teeth.
It's a third set of teeth. You have your primary teeth. We call them the baby teeth. When you lose your baby teeth, you get your permanent teeth, but God didn't make them permanent. Very few people are able to keep all of their teeth. They wear out, they break, maybe they get some gum disease. And so the third set of teeth are the dental implants. They don't get cavities. You don't have to drill and fill them. And we love this procedure because everyone's so happy about it. The third set of teeth can last them a lifetime, but they do have to see their dentist to have regular cleanings, and they have to do their own oral hygiene.
Like every 6 months?
Yeah, every 6 months for most patients. Some patients may have to go 3 times a year. We let them know what we think our opinion is, and you know, they're kind of back in the system.
And we're short on time, so I know you brought these photos. What are we looking at?
Well, first photo we're looking at is Mary. Mary came to us. She was missing many of her teeth. And she suffered going back and forth in the dentist. She had a partial denture in the upper. She had a partial denture in the lower. She didn't even wear it because it was so uncomfortable.
Doesn't look good there.
No, and she couldn't chew. She was having difficulty biting. She was avoiding going out to dinner. She's a typical patient. She's held off, but she finally got referred to us by another patient who we had done this procedure. And her option, she had seen a couple doctors, was to have dentures, have the rest of her teeth pulled and have dentures.
You hate dentures?
Well,
I don't want to put words in your mouth, but you don't like dentures.
It's the beginning and the end, and it's documented that it has an ill effect on your health.
Okay.
Your general health. So instead, what we did the same day procedure, smile lift dental implant procedure, and within a week, she was a different person. So what we did on Mary, take a look at her. Mm-hmm. Doesn't she look great?
Yeah, she does.
I mean, she feels younger. She asked me not to say her age on this show because she says, I'm younger now. And she looks it. And it was simple, what we did. We removed her teeth very carefully, and we placed 4 implants in her upper jaw, 4 implants in her lower jaw, and we delivered the teeth in a couple hours. And she immediately started smiling. I mean, she looked good from the moment, but this picture was taken about 10 days later. She didn't have any pain. She was so happy. She's a different person. That's why we love this procedure. She was very concerned because she has some soft bones in her family, the doctors have told her, but she didn't really need to be. She could actually start enjoying food, chewing foods that are nutritious. She has better taste. Her palate was covered with her partial denture. She can taste the food, and she can eat just about anything she wants.
Meat,
everything. But she said, I have some osteoporosis, so I'm gonna wait a few weeks. I'm gonna wait longer. She was very careful because I don't want, it's not that I don't want to do this again. I don't want anything to go wrong because I feel so good with these teeth. They already feel like my teeth. She adjusted fairly quickly. So it's an amazing thing.
What about like
for a
vegetables?
doctor to do that for someone?
But vegetables, could she use her front teeth? I mean, could she bite into a carrot or an apple or corn on the cob?
Afterwards, when it's all done and the healing has occurred, she can eat everything. She can eat carrots. She can do corn on the cob. She can bite into an apple. Mary decided on her own to delay that a little bit.
Okay.
Because she said, this is the best thing that's happened to me in 40 years. Look at the difference. And she's our typical patient. I would say most of the patients react equal to her.
Is that the challenge, though, just getting them to believe it?
You know, here's the thing. What I see is they've been misinformed. Maybe they talked to a patient that went to a dentist that doesn't really have the training. And they don't even know what they don't know. I mean, so they've told them the wrong thing. And so once they...
The wrong thing meaning dental implants are not for you.
Yeah,
You're
the
too
dental
old.
implants are not for them, or they should just replace the one tooth that was hurting them at that moment, which is not the right way. That's a piecemeal way. If you have teeth that are all failing and you place a couple implants, you're a good candidate to have a problem. We have to take care of the problem completely, not a patch.
You're saying, and I don't want to put words in your mouth, but that every day in Miami, every day where you are, that patients are being told you're too old, you don't have enough bone, you can't do dental implants, and you're saying, and you want to wipe that out, that that's not the case?
For the majority, the vast majority, it's not true.
I know you want to be nice to other dentists and specialists. Okay,
Here's
good.
another patient. She came in, and you see that she has no smile. She was really ashamed of her teeth. She was hiding behind her lips. And she had just a few teeth, and they were in bad condition. And I explained to her, I said, this is affecting your health. Let's consult with your physician. Physician was all for it. So what we did for her, we placed 4 implants in the lower, 4 implants in the upper jaw, put in the teeth within a couple hours. She was like a new person.
So this is a full set of teeth?
Full set of teeth.
Okay.
Upper and lower. And we completely, changed her. And you could see in the post-treatment picture that she's already a different person.
Anybody can look and see she looks, 10 years younger.
At least 10 years.
Doesn't look like the same lady.
At least 10 years. And you know what? She's enjoying her food. So now what she does, she sends me bottles of wine because we talk about wine. She's French, and she talked about wine, and she said, you know, now I enjoy my wine. I want you to enjoy it too. And she sends me special bottles.
Very nice.
I mean, we really bond.
How do you get patients like this?
They're like family to us. You know, once you change someone like this, it's amazing. They want to tell other people. They want to tell other people. Sometimes they're careful. They come and tell me, yeah, I have this friend, and you know, she's where I was. She does, you know, and I don't know how to tell her. And I said, well, you know, why don't you tell her to come see me?
So dentists send you a lot of these patients?
Yes, pretty much. I work with the top dentists in the whole Miami area. These are dentists that do continuing education. They know about this procedure and this technology. They have seen the results. So they want their patients to get this. They don't want their patients to keep coming to their office and suffering with a little patch job or a little procedure. Once you get to the point where all your teeth are failing or where your dentures can never be comfortable, the good dentist says you must go find out about dental implants. If they're not trained, they tell you you don't have enough bone because they have a 2-dimensional x-ray, not a true 3-dimensional x-ray. It's amazing when you put it on a 3-dimensional with a software, with a high-end software that we use, the patients see it. They say, oh yeah, I have enough bone. Because we actually show them, we place the implant virtually on the computer. And then they say, that's where my implants are gonna be? They get, you know, they love it.
How common is it that people go to you, you do the whole procedure, but initially they said to you, doctor, I was told I couldn't do this at another doctor. Is that rare?
It's pretty common.
Is that right? Okay,
it's pretty common.
So get an opinion, get a second opinion, go to Dr. Sclar.
Yeah. And
you lecture on this. I guess you just came back from lecturing, teaching other dentists how to do this.
Yes. We train dentists, you know, we do presentations, but to learn this kind of procedure, it's intensive training. They have to spend a lot of time with us, and it takes them time. It's not an overnight thing, but yeah, we've trained many successful dentists to do this.
Look, I know everybody's afraid of oral surgeons especially, but everybody's afraid of the dentist. Talk to your office, they say patients love him. That you have some funds, and you even say some crazy things to patients.
Yeah.
Like you joke with them.
We want them to be comfortable. We want them, and I tell patients, when we do the entire consultation, and I spend a lot of time with patients, you know, and that's my thing. I want to see if we're a good fit.
A denture wearer goes in, they're on a consult with you. What do they want to know every time? Like, what are the questions they ask every time?
Well, people want to know, that very common, it's always the same questions. Is this going to hurt?
It does seem painful.
You know, I've been doing this procedure since probably 9 years. The concept really came to the US 10 years ago. I was learning about it in the first year. And we've done hundreds and hundreds of patients. And we had one single patient that had a headache, but a bad headache after, but it was related to something else. It wasn't related to what we did and it resolved. I mean, this is a procedure because the way we do it, there's no pressure on the gums. If it's done correctly, there can be no pressure.
So the bone doesn't really have feeling too much.
And they just don't have pain. The other thing is patients will say, I've had bad breath for 20 years. So, you know, we have female patients, we have male patients. Sometimes we have a patient, the male patient will come in and say, I can't really date because I have this smell in my mouth. And they know it, you know, but they're like, nobody's
So you clean that up.
Yeah, nobody's been able to tell me how to fix it. And we look at them and, you know, our consultations are not short. We spend at least an hour with the patient.
Do you ever get excited, you're on the consult, and they're telling you their problems, and you're going, boy, this is going to be good?
Yeah, and the other people are worried about cost. But, you know, actually, this technology is less costly than the previous ways to do it, which required more implants. In most cases, they're getting 4 implants. Some people need 5 or 6.
So 4 implants for just a complete set of teeth?
Yes, because they're specialized implants. They're the top implants really in the world.
You're using special secret implants?
They're not secret.
I was just kidding
They're not
about
secret,
that.
but they were developed for this kind of procedure.
This type of thing. Now we are just about out of time. You have a couple more photos.
Oh, absolutely.
Okay.
Absolutely. Look, take a look at this one, Randy. This patient came in and she had moved to Miami and she had very terrible periodontal disease, gum disease. So she was referred from doctors from Atlanta area and to come see me. And she had landed this great job in Miami, but she wanted her teeth fixed. So she came right in to see me. She had just moved there 2 days before. She said, what can you do? They said you do something in the same day. So that was on a Monday. We made time for her on Friday. We did her same procedure, 4 implants in the upper, 4 in the lower. And I told her, maybe take a week off. I mean, don't go to work on this job yet. So on Monday, Friday morning we did it. On Monday morning at 8 o'clock, she was in my office. She didn't call for an appointment. She said, I want to talk to Dr. Sclar. And I said, hey, what's up? Janet's her name. Janet, what's up? She said, no, I just want you to look at me. Look at me. Don't I look great? She goes, so why can't I go to work today? And I said, well, I guess you can.
So this is like a smile makeover too. This is cosmetic dentistry.
I mean, look at her.
I mean, it looks great.
And
Did they say, I wish I would have done this years ago?
She said, if I had known, if someone in my area was doing this, she said, all my opportunities were limited by my teeth. And so to get this job, she went and did the interview. I knew I needed new teeth, and they said you were the guy. So we took care of her.
Wow.
Check this one out. Very impressive woman. She was a nuclear physicist. So she has upper and lower denture. Do you see that her mouth is strained? That's called denture face. If she smiles a certain way, the denture drops. Look at her eyes. It's part of the strain. That's what we call denture face. Look at the after.
Wow.
She looks 15 years younger. Look at that smile. And look how she's changed. It's amazing.
So she went from dentures to a fixed set of teeth in one day.
One day. One day. Her brother was an oral surgeon. He came down for the procedure. He referred her.
Her eyes are different on the after. Anyway, we're going to have to go through these photos.
And look at this one. Let me tell you her story. Look at her teeth. She has tiny little teeth. They're all broken off. She had a lot of trauma in her life, and then she never took care of herself. But her daughter brought her in. Her daughter's a physician, referred her to me because she knows that I do that. Look at the difference.
Very nice.
It's amazing, right? And
yeah.
Look at this gentleman. He's a coach, football coach in a local, field, and he's great with the kids. But the problem is, he said, Doc, kids are afraid of me when I smile. Look at his smile.
Yeah.
It's scary.
Did he not smile because of it?
Sometimes he would smile and the kids would get scared and they would say, Coach, what's the matter with your mouth? The kids would say it.
Okay.
Right?
Jeez.
And so some of the kids that he coaches were in our office for like general oral surgery, like wisdom teeth. And so we said, get him to come in. And he came in. And when I told him we can do it in one day, he was amazed. Look at the difference.
Very nice.
It's amazing.
And he can eat whatever he wants.
Whatever he wants.
Like beef jerky? I know that
Everything.
sounds crazy. I mean, steak,
beef
whatever.
jerky, everything.
Okay.
And this gentleman, he's a pastor.
He looks very serious.
He was in pain with his teeth when he came in here. And he's a great speaker. He has the biggest congregation in Florida and all in South and Central America. People love this man. And he self-diagnosed in a good way. Sometimes people say, no, I'm too old. He said, I'm not too old.
So he was wearing a denture? Was he wearing a denture?
No, he had failing teeth.
His teeth were bad.
Awful. Gum disease all over the place.
So they had to go. I mean,
they had to go.
So he was going to be wearing a denture.
But he said, I can't be up there, because he's on camera, like you're on camera, and I'm on camera. And he says, I heard that you can do this. And he heard through his dentist, is a specialist, a prosthodontist in Miami. And he said, it's a challenging case, your case, but we'll get it done. Because I work with only the top dentists, and we work all in the facility. We do the surgery, and the teeth are made in my facility.
So this guy, on the day of the procedure, he walks out with teeth.
And amazing.
Beautiful teeth.
Yeah. He's the only patient that ever even said he had a headache. But we found out it was sinus, and we took care of it. Look at this. Not as often do we see a young lady in her 40s, but we do see it. This is this patient. smiling. She's guarding her smile. Her biggest trauma in life is the fact that she has bad teeth, failing teeth. And she's lost most of them. And she's been to dentists, and nobody's given her an option. I met her, she's a makeup artist. We brought her in, we did the consultation. She was very scared because all her dental experiences were negative. But we sedated her, and it changed her life. 6 weeks after the procedure,
wow, look at that.
Yeah, look at her. She got a major job in a design firm. She came into our office wearing some big high design because she's a beautiful woman. Outfit that was like a $10,000 outfit, and she said, Dr. Sclar, look at me. My whole life has changed because of this procedure.
Good.
So it's amazing. I mean, that's why we love it.
So no more dentures.
No more dentures.
No more dentures. Now,
And
by the way,
if you have failing teeth, let them go.
you're an oral surgeon, right? You're a specialist. So do you have a feeling that if you're going to get this done, you might as well go to an oral surgeon and it doesn't cost you more?
You need to go to someone who's had formal training and experience.
Okay.
They have training and experience. And that's easy for patients. You just ask around.
Good.
But you also, patients have a gut feeling. They need to be comfortable when whatever office they go into, they need to be comfortable.
All right.
And they should always go with their gut.
And we are out of time, but if a denture wearer goes to you, what are their options? They're wearing false teeth. What are their options as far as dental implants?
Well, we can use 2 implants, say in the lower jaw. We can do 2 implants that can snap a denture in, snap it out. In the upper, it usually requires 4, but if we're going to do the 4, I think they're much better served to have a fixed set of teeth that are like their natural teeth. They're going to feel better about them, and there's actually less maintenance. And the other thing with the upper fixed teeth is the palate is open, and the flavor and enjoyment of food comes back. That's been the best thing.
Final message, somebody watching this, loose-fitting denture. Maybe they think they're too old. What do you say to them?
No, absolutely, they should come in. Come in, they meet us, meet our team, and we can help them. We can help them. We can give them that beautiful smile, and we can give them their life back as far as chewing and so forth.
All right, thanks again for coming on the show. Great stuff.
Absolutely.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.